You remembered every phone number of every friend you had growing up. You remembered anniversaries, directions, the name of every person you met at a party. And now you walk into a room and just stand there, trying to remember why you came in. And you told yourself it's normal. You told yourself it's age. But what if it isn't? What if the answer isn't in your brain at all, but in your medicine cabinet? I've been practicing medicine for over 20 years. I've sat with thousands of patients, reviewed thousands of charts, and I have watched something happen again and again that nobody is talking about loudly enough. Older adults, sharp, intelligent, vibrant people, losing pieces of their memory, their clarity, their personality. And in a significant number of those cases, the culprit wasn't Alzheimer's. It wasn't dementia. It was a combination of medications that their doctors, good doctors, careful doctors, had prescribed with the best intentions in the world. Today, I'm going to tell you exactly what those medications are. I'm going to tell you how they work against your brain, why this combination is so dangerous, specifically after the age of 60, and what you can do about it, starting this week. Stay with me until the end, because there is a twist in this story that I genuinely did not see coming when I first started researching this, and it changed the way I look at memory loss forever. Let's start with something called polypharmacy. It's a word you may not have heard, but if you are over 60 and you take more than one prescription medication, this word is about you. Polypharmacy simply means the use of multiple medications simultaneously. And according to data from the CDC, nearly 40% of adults over the age of 65 in the United States take 5 or more prescription medications every single day. Some take 10, some take 15. Now here's what your doctor knows. Each of those medications was tested, approved, and prescribed based on research into that drug individually. What happens far less often, in research labs, in clinical trials, and sometimes even in doctors' offices, is a rigorous examination of what happens when all those drugs interact inside one human body, simultaneously, over years. And that gap between what we know about individual drugs and what we know about combinations, is where memory goes to quietly disappear. Let me introduce you to Margaret, 71 years old, retired schoolteacher, the kind of woman who did the crossword in pen, who remembered the birthdays of all 11 of her grandchildren without checking her phone, who could recite poetry she'd learned in college. Her daughter brought her to see me because over the course of about 18 months, something had shifted. Margaret was repeating herself in conversations. She was getting confused about dates. She'd gotten lost driving to her sister's house, a house she'd been visiting for 30 years. Her family was terrified. They'd already started quietly Googling memory care facilities. But before we went down that road, I did something I always do. I sat down with her medication list. She was taking a medication for her bladder. She was taking a medication for allergies, an over-the-counter one she'd been buying herself for years. She was taking a sleep aid, and she was taking an antidepressant that had been prescribed after her husband passed away 3 years earlier. On the surface, that list looks completely reasonable, doesn't it? Bladder issues are common after 60. Allergies are common. Sleep problems are incredibly common. And grief deserves treatment. But when I looked at what those 4 medications had in common, my stomach dropped. Every single one of them was anticholinergic. And that word, anticholinergic, that is the word that every person over the age of 60 needs to know. Write it down. Say it to your doctor. Because it may be the most important medical term you learn this year. Here's what it means. Acetylcholine is one of the most critical neurotransmitters in your brain. It is essential for memory formation, for learning, for attention, for cognitive processing. Think of acetylcholine as the electrical current that runs through your brain's memory circuits. Without it, the lights start going out. Anticholinergic drugs block the effects of acetylcholine. They do this intentionally in some cases, to relax bladder muscles, to dry up allergic secretions, to induce sleep. The blockade of acetylcholine in those specific tissues is the mechanism that makes the drug work. But here's the problem. Your brain is full of acetylcholine receptors, and these drugs don't stay neatly in your bladder or your sinuses. They cross into your brain. They block acetylcholine there too. In a young brain, this effect is temporary and relatively manageable. The brain compensates. It recovers. But after 60, your brain's acetylcholine system is already under natural age-related pressure. Your baseline acetylcholine production is declining. Your brain has less reserve, less buffer. And when you introduce one anticholinergic drug, you feel foggy. When you introduce 2, the fog deepens. When you introduce 3 or 4, which is what was happening to Margaret, you can look, by every clinical measure, like someone in the early stages of dementia. This condition even has a name. It's called anticholinergic syndrome. And a landmark study published in JAMA Internal Medicine, one of the most respected medical journals in the world, followed nearly 3,500 people over 65 for 7 years and found that those with the highest cumulative exposure to anticholinergic medications had a 54% increased risk of developing dementia. 54%. Let me say that again because I need you to feel the weight of it. Taking multiple anticholinergic medications over time can increase your risk of dementia by more than half. And millions of people are doing this right now, today, without any idea. Now here's the part that stops people cold when I tell them in my office. Many of the most commonly used anticholinergic medications are not obscure drugs. They are not experimental. They are household names. Some of them don't even require a prescription. Benadryl, that's diphenhydramine, one of the most potent anticholinergic drugs in common use. Millions of older adults take it for allergies, for colds, and as a sleep aid. It's the active ingredient in ZQuil, in Unisom, in Tylenol PM. It feels benign because it's on the drugstore shelf next to the candy bars. But for a brain over 60, it is a chemical that actively works against your memory. Urologicals, medications for overactive bladder like oxybutynin and tolterodine. Enormously common prescriptions for older adults, strongly anticholinergic. Certain antidepressants, particularly older tricyclic antidepressants like amitriptyline and nortriptyline, also anticholinergic. Certain antihistamines, certain antipsychotics, certain medications for dizziness and nausea, certain antispasmodics for bowel issues. The list is longer than most people expect. And when these drugs combine in your system, and this is the part that most doctors are not calculating when they write each individual prescription, their anticholinergic effects don't just add together. Research suggests they can potentiate each other. They can amplify each other's impact on your brain's chemistry in ways that are genuinely difficult to predict. But here is the twist I promised you, the one I didn't see coming. Are you ready? Because this one still gets me. In a significant number of cases, a number that is far higher than the medical community once believed, what looks like early Alzheimer's disease is actually anticholinergic cognitive impairment. It is drug-induced, it is reversible, and it has been misdiagnosed as dementia in patients who then spent years in memory care, taking additional medications, losing themselves, when the real answer was to look at what was already in their medicine cabinet. Margaret was one of those people. We worked with her primary care physician. We systematically reduced and replaced her anticholinergic medications over several months, carefully, never abruptly, always with monitoring. We found a non-anticholinergic option for her bladder. We switched her antihistamine. We discussed her sleep hygiene and explored other approaches. We transitioned her antidepressant. Within 4 months, her daughter called me in tears, not sad tears. Margaret had remembered, unprompted, the name of a student she taught in 1987. She had called her sister to make plans for the holidays. She had initiated a phone call for the first time in over a year. She was back. She was not fully back in every way. Some of the time lost was real. Some of the damage was real. But the woman who had nearly been placed in memory care went home to her own house, her crossword puzzle, and her 11 grandchildren's birthdays. That is why I make these videos. That is exactly why. Now let me give you something practical, something you can do right now, today, before this video is even finished. There is a tool called the Anticholinergic Cognitive Burden Scale, or ACB scale. It assigns each medication a score from 0 to 3 based on how strongly anticholinergic it is. A total score of 3 or more has been associated with measurable cognitive impairment. This scale is available publicly online. You can look up every medication you or your loved one takes and calculate a rough total burden score. I want you to do that this week. And then I want you to make an appointment with your doctor and use a specific phrase. Write this down. The phrase is, I would like to review my medications for anticholinergic burden. Those exact words. Because that phrase signals to your doctor that you've done your research, that you understand the concern, and that you want a systematic review, not just a reassurance that everything looks fine. A good doctor will welcome that conversation, and if yours doesn't, if they dismiss it or brush it off, I want you to respectfully and firmly advocate for yourself, because you have every right to. Now let me address something I know some of you are thinking. What if I've been taking these medications for years? What if I stop them and something else goes wrong? Am I supposed to just give up managing my bladder, my allergies, my sleep, my depression? Absolutely not. And I want to be very clear about something. You should never stop a prescription medication abruptly or without medical supervision. That is not what I'm telling you. Some of these drugs have withdrawal effects. Some of them are managing conditions that need management. What I'm telling you is that in many cases there are alternatives. For overactive bladder, there are newer medications with much lower anticholinergic profiles. For sleep, there are behavioral interventions that research shows are more effective long-term than any medication. For allergies, second-generation antihistamines like cetirizine and loratadine are significantly less anticholinergic than older options. For depression, many modern antidepressants carry little to no anticholinergic burden. The goal isn't to strip away every medication that helps you function. The goal is to make sure that the medications helping one part of your body aren't quietly costing you your mind. There's another combination I have to mention before we close. Because we've been talking about anticholinergics, but there's a second category of drug interaction that destroys memory in older adults that doesn't get nearly enough attention. Benzodiazepines combined with opioids. Benzodiazepines, drugs like Xanax, Valium, Klonopin, Ativan, are prescribed for anxiety and sleep. They are deeply sedating to the central nervous system. Opioid medications, prescribed for chronic pain, which is extraordinarily common after 60, are also central nervous system depressants. Together, they don't just add sedation, they can profoundly impair cognitive function, create states of confusion that mimic dementia, significantly increase fall risk, and yes, in high doses or in vulnerable individuals, they can be fatal. The FDA has a black box warning about this combination. A black box warning is the strongest warning the FDA can place on a medication. It exists because this combination has killed people. And yet, it continues to be co-prescribed at rates that should alarm all of us. If you or someone you love is taking both a benzodiazepine and an opioid, please have that specific conversation with your prescribing physician. Ask about the risks, ask about alternatives, ask whether both are still necessary. I want to take a moment to speak to the adult children and caregivers who are watching this. Because sometimes the person who needs to hear this information is not the patient, it's you. If your parent or grandparent seems like they've been getting more confused lately, if they seem less like themselves, if you've started having whispered conversations about memory care, please, before you assume the worst, look at their medication list. Bring it to a physician who will take the time to review it thoroughly. Request a medication reconciliation. Ask specifically about anticholinergic burden. You may find that what looks like the beginning of the end is actually something entirely different, something fixable, and that possibility is worth fighting for. Let me leave you with this. Your memory is not just a function, it is your identity. It is every conversation you've ever had with someone you love, every lesson you've ever learned, every moment that made you who you are. Protecting it is not vanity, it is not excessive, it is one of the most profound acts of self-care you can undertake. You are not powerless here. That's what I need you to walk away believing. The body is not simply deteriorating on a fixed schedule that no one can alter. There are things in your control. There are questions you can ask. There are changes that can make a real, measurable, life-altering difference. Margaret's daughter didn't give up. She pushed. She brought her mother in one more time, to one more doctor, and asked one more question. And her mother came back. Ask the question. Look at the list. Know the word, anticholinergic. Say it to your doctor. And share this video with every person over 60 in your life who deserves to know what I've just told you. Because this information doesn't belong only in medical journals and doctors' offices. It belongs with you. I'll see you in the next one. Take care of yourself and take care of each other.